Hello. All right, now let's see if it'll let me do what I'm supposed to do. Da, 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 da. All right, can everybody see my screen okay? Sweet.
Yes.
All right. So I think we have Sherelle here today. Hi, Sherelle.
Hi, Dr. Lori.
The clinical faculty. Natalie's here, also one of the clinical faculty, Natalie Perry. Hi, Natalie. So I'm really glad to have everybody here today, and I'm really excited about this topic because increasingly the research is showing some pretty substantial evidence to support the fact that, like other organs in the body, the brain needs a healthy diet. And there are supplements and so-called nutraceuticals that actually have evidence in the use of certain mental health conditions. Nowadays, you see supplements for everything online. Amazon has them. You get ads on them for, on Facebook for them. Most of the ones that you see have limited, if any, evidence for what they purport to do. And so the reason that we're doing this as a clinical pearl is to provide you with some idea about the things that are actually evidence-based that you can suggest for your patients. So my hope today is that, we're going to be able to define the terminology related to how much processing food undergoes. Describe the effects of a poor dietary intake on health in general and mental health specifically. List some of the components that negatively impact the brain. Some of them are shockers. And then talk about some of the things that actually have some good evidence. So let's talk about some definitions. And these are pretty widely used when discussing dietary foods and how they're processed. So unprocessed or minimally processed foods are basically food off the vine, off the tree, whatever. They're not changed from their natural state. Or they may be slightly changed, like when they're frozen to allow for storage. And examples are things, fresh fruits and veg, nuts, plain yogurt, milk, coffee, tea. Processed culinary ingredients are things that are used to prepare foods that actually come from those unprocessed or minimally processed foods. So examples would be olive oil, seeds or nuts, vinegar made from fermented wines, honey that comes from honeycombs, syrup from trees. Those are all things that are somewhat processed, like to get them into a container, make them available, storable. Processed foods, a lot of times we hear the term processed foods and we automatically think bad, right? But that's not necessarily the case. So what makes a food processed is that they have added salt, sugar, or fat. And that's not necessarily a bad thing. For instance, home canning. We add sugars or salts because of the effect that they have on preserving the food so they can be stored long-term, right? Most processed foods, when using this definition, have 2 to 3 ingredients and don't require a lot of preparation to make them edible. Okay, now this is the one that all of us should be a little more concerned about, is the ultra processed foods or highly processed foods. These originally start from previous groups like the minimally processed foods, and then we add all the stuff: salt, sugar, fat, artificial flavors, artificial sweeteners, thickeners, emulsifiers. And when you look at the packaging, On this food, it's really difficult to identify most of the ingredients. So this is usually mass-produced food using cheap ingredients. And there's some evidence in the research by, nutritional scientists that some of these foods are actually manufactured in a way to increase cravings. And so our patients are they get stuck on a loop because these are cheap and because they do get those cravings, right? So examples here, most any snack food on the market, lunch meats, frozen dinners, most cereals, these are the ultra processed foods, and we're going to be referring to these a bit. Any questions about those definitions? Okay. So what effect does the intake of ultra processed foods have on the body at large? So the first thing you have to understand is that when they're processed that way, most of these processes destroy some nutrients, and manufacturers will add back in some of them, but fortifying does not do the same thing as the food in its natural state would. Saturated fats, added sugars, sodium, all of these contribute about 90% of the calories are from sugars alone, but all of these create more inflammation. And inflammation in the last 20 years as a nurse, inflammation has been found to be a culprit in most of the disease processes that we deal with as nurses on a regular basis. So heart disease, strokes, obesity, both a product of and a producer of inflammation, a bidirectional relationship there. Low-grade inflammation, chronic low-grade inflammation increases risk for autoimmune diseases, also increases body fat, and chronic inflammation increases oxidative stress. So oxidative stress, we know, is one of the things that contributes to accelerated aging. The high consumption of sugars instead of complex carbohydrates actually alters the gut microbiome in a negative way. So the gut microbiome, we now know, has a direct feed to the brain through the enteric nervous system. The amount of sugar that the American diet takes in on a regular basis contributes to the overgrowth of bacteria that are capable of producing disease. In addition, that alteration in the gut microbiome leads to leaky cells in the intestines, which means that you're more likely to have translocation of gut bacteria causing all sorts of things like sepsis and disease processes and what have you. The other thing that happens with some of these high glucose foods is it contributes to the development of hyperinsulinemia. The elevated insulin all by itself contributes to the development of obesity and other inflammatory diseases, but it also oddly impairs sodium metabolism. So it can contribute to fluid retention and issues with maintenance of the fluid balance through the kidneys. Now, mental health. The brain is not an island. So if you've got all of these tremendous inflammatory markers floating through the body, that doesn't somehow magically stop at the blood-brain barrier. And so when you've got somebody who's got obesity, adipose tissue creates inflammatory chemicals that further inflame other tissues, right? obesity can cause problems with mental health. Artificial sweeteners and monosodium glutamate, MSG, can actually cause problems with the production of dopamine, serotonin, and norepinephrine. So one of the questions we should actually be asking our patients is how many of them drink diet sodas. I have some, when I ask them, who say, I drink 5 or 6 of them a day, and they're depressed. Well, the reason they're depressed is because they're not producing normal amounts of dopamine, serotonin, norepinephrine. And so this is problematic for a number of reasons. They also, because of the inhibition of dopamine and norepinephrine production, these are part of the HPA axis. So these sweeteners can also cause disordered function of the hypothalamus pituitary axis. Some of the emulsifiers. So in case you're having trouble remembering, an emulsifier is a chemical added to food so that fats and fluid can combine and not split. So you see that in a lot of foods nowadays. These are made with a couple of different types of carbohydrates, like carboxymethylcellulose and polysorbate 80. These actually kill off some of the gut microbiome, which, and the gut microbiome, just as a refresher, is responsible for helping to produce some of the short chain fatty acids needed for brain health and many of the amino acids needed for enzymatic function. So these emulsifiers actually decrease the ability of the gut to produce things needed for cellular function. There are some findings that are pretty consistently finding that ultra-processed foods contribute to things like depression, anxiety, alcohol, and food addictions, and to increased perceived stress levels. Some findings suggest that schizophrenia and depression both have problems with glutamate, with decreased glutathione, which is a precursor, and glutamate metabolism. They also have fewer antioxidants and deficiencies or near deficiencies in some of the necessary vitamins in terms of brain function. So the gut microbiome is so important for so many reasons. They've also found that the diet effect on the gut microbiome can actually lower brain-derived neurotrophic factor. So going back to psychopharmacology, BDNF is a chemical that increases brain cell size, increases neural cell connections, and increases function of the cells themselves. So for instance, somebody who has lower BDNF is going to have less functionality in terms of connectivity between different cells, but also it reduces the function of the cells who produce some of the neurotransmitters. Another thing that it does is it reduces hippocampal volume. So the hippocampus, responsible for things like cognition, mood, memory, and this will also cause accelerated age-related cognitive decline. So protecting that gut microbiome starts to look better and better all the time. Any questions so far? Okay, moving on. So ultra-processed foods increase rates of depression and internalizing and externalizing symptoms in adolescents. So when you think about internalizing and externalizing symptoms, what do you think about? So internalizing symptoms are things like those depression, those depressive thoughts. Externalizing symptoms are things like self-harm, things that they show outward, anger, irritability. It's also related to sleep problems, and that's across age groups, right? A higher risk for dementia and vascular dementia. And when you think about what's going on, right? When you think about inflammation in the body and the development of things like atherosclerosis, that makes sense because it's not just happening in the vessels of the heart, it's happening throughout the body, including in the brain, so that you get less blood flow to more and more areas of the brain, resulting in loss of function. So what are some of the things we should be encouraging our patients to limit? Certain saturated fats. Now, usually we hear saturated fats and we automatically think that's just not good. Well, there have been identified something called very long chain saturated fats found in nuts and dairy that actually have properties similar to the omega-3s. So they're not all bad, but omega-3 fatty acids are the best fats, right? Along with monounsaturated and that kind of thing. This one's a heartbreaker: coffee and chocolate. I have 1 cup a day. I used to have a pot a day, but my cup is a bucket. So and chocolate both have chemicals that decrease the effectiveness of some neurotransmitters temporarily. Now, they also both have some flavonoids and polyphenols that are good antioxidants, right? And so it's one of those things that it should be in moderation. And we'll talk about what moderation is when we get further along. Alcohol. Everybody knows alcohol is a central nervous system depressant. And for a lot of years, we heard that men could have 2 drinks, women could have 1 drink. The increasing evidence suggests that any alcohol is bad. One of the metabolites of alcohol, acetaldehyde, is actually a neurotoxin. And so patients who drink on the regular are doing pretty frequent damage to brain cells, and that increases inflammation, which, as we've talked about, absolutely increases the risk for a lot of mental illnesses. Grapefruit juice can inhibit first pass metabolism of some cytochrome P450-3A substrates. So unless your patient is aware of all of the drugs that they're taking that are cytochrome P450-3A substrates, we should be encouraging them to avoid grapefruit juice. There are other options available. Okay. MSG, monosodium glutamate, because of its impact on brain glutamate levels, increases anxiety and can make PTSD symptoms elevated. And so these are some things, and this is certainly not an exhaustive list. These are just some of the more common ones. Any questions? Everybody doing okay? So let's talk about the goodies. Brain health requires adequate complex carbohydrates, fruits, vegetables, whole grains, some nuts or seeds, essential fatty acids. And that includes things like the omega-3s, some of the monounsaturated fats, and amino acids. How many of you have at some point been told that people who are on a vegan diet will have difficulty getting the right combinations to be able to produce the right amino acids and proteins? The truth of the matter is, a lot of the foods that people on a vegan or vegetarian diet eat, provided they're not eating the same food every day, they're going to be able to produce the right amino acids. And so that's kind of a misnomer. One of the things they might be low in, though, are things like folate and B12, which tend to be heavier, and zinc in meats. And so they would need supplementation in that regard. There is an inverse relationship between healthy diet and risk for depression. So some of the things we should be encouraging in terms of healthy diet, the Mediterranean diet comes up often when talking about healthy diet and brain health. And that's because the Mediterranean diet is rich in cold water fishes and fish. It's rich in plant-based foods, rich in things like magnesium, zinc, and iron, which are cofactors for the production of a lot of chemicals in our bodies. There are a lot of small molecules in plants that inhibit inflammation, and they include things like curcumin. So nowadays, curcumin we use, I use a lot because I live in the Southwest, and food from South America makes me happy. So curcumin, or cumin, is a chemical that's found in some plants that reduces inflammation. S-methylcysteine is found in things like garlic and onions, and the vegetables from the brassica group, like broccoli or cabbage. Beans and spinach nitrate. Omega-3 fatty acids are huge. This is one of the things that has substantial evidence to support its use as an adjunct in the care of patients with things like depression. So it reduces inflammation, and it improves mood and increases brain-derived neurotrophic factor. So some of the best sources are going to be your cold water fishes, your fatty fishes like salmon, anchovies, herring. There are some types of algae that have good omega-3s. They tend to be ALA rather than EPA or DHA, which are chemically different, but they do, and the ALA is converted to the others. So the evidence supports supplementation with a high EPA to DHA ratio. They want at least 2 to 1. The evidence for using it as an adjunct in depression call for 1 to 2 grams of EPA daily. So these can be found most commonly, the EPA and DHA, in fish oil supplements. I usually tell my patients who are going to try it, take it at night so that the belching fish smell happens while you're sleeping, and hopefully your partner sleeps right through it. Calcium. SSRIs actually inhibit the absorption of calcium in the bones. So patients who are prescribed an SSRI for depression or anxiety or what have you should be taking calcium supplements to prevent problems with bone health. Patients with depression are often found to have folate levels that are on the low end of normal, and supplementation in patients who are resistant depression is a really good idea and is an absolute necessity for your patients who might be using alcohol on the regular. So for alcohol abuse, you also want to do magnesium and thiamine. So folate can be found in dark green leafy vegetables, beans, fresh fruits, whole grains, and some meats. Blueberries. There's actual research just on the chemicals in blueberries. So blueberries all by themselves increase serotonin. They just apparently make you happy. They reduce inflammatory cytokines, and they do that by destroying oxygen-free radicals that cause cell wall damage and increase inflammation. N-acetylcysteine, NAC. Anybody here ever done respiratory therapy? N-acetylcysteine was used as a mucolytic. Smells horrible. Don't get it on your clothes. Turns out it has brilliant anti-inflammatory properties. It's shown some promise for OCD. Natural sources of cysteine: chicken breast, tuna, lentils, oatmeal, sunflower seeds, and some yogurts. But N-acetylcysteine can be found in the supplement aisle. 600 milligrams is typically the dose, and so can be found over the counter. I recommend this a lot for patients with bigger inflammatory things like bipolar disorder, because there's some evidence to suggest that it can be beneficial. Magnesium. Patients who have ADHD and depression often have a deficiency of magnesium. Magnesium is also one of those really great nutrients because magnesium is a cofactor in so many processes in the body. It's important for conduction of electricity through skeletal muscles and the heart. It's a cofactor in the development of a lot of different enzymes. So magnesium replacement, and if your patient's got healthy functioning kidneys, 250 or 400 is not going to hurt them. And it's taken at night because it does help with relaxation. Can be found in dark green leafy vegetables, nuts, seeds, whole grains, fish, and poultry. Zinc is another pretty cool chemical. Zinc modulates the serotonergic system. So if it's low, zinc helps increase it. If you got too much serotonin aboard, zinc helps to limit the toxicity. And it does this in a number of ways, but it also is involved in minimizing excitotoxicity from things like too much glutamate. It has been linked deficiencies to anxiety and depression. Zinc can be found in poultry, shellfish, nuts, whole grains. SAMe is another molecule that actually has pretty good research to support it as an adjunctive treatment for depression. But oddly, there's a small risk that you can induce mania in patients who are so disposed. So this is another molecule that's important for either the production or activation of things like hormones, some of the nucleic acids, phospholipids, neurotransmitters. This one can be spendy, but patients can get a similar effect by incorporating natural sources of methionine. And so methionine can be found in things like nuts, beef, lamb, turkey, shellfish, soy, and beans. SAMe in Europe is a prescription drug. Here in the United States, it is not, but as an over-the-counter, it's pretty expensive for a lot of patients. So the methionine-rich diet can be helpful. Vitamin D. Everybody knows about vitamin D, right? Get out in the sun for a little while every day. But vitamin D in the northern hemisphere, anybody who's north of Florida, the sun doesn't penetrate the atmosphere the same way. And so anybody in the northern hemisphere, unless they're outside a lot, probably needs vitamin D supplementation. The vitamin D has a number of effects in the brain. There's receptors in lots of different places. It regulates serotonin levels. There's also some suggestion that vitamin D can increase rates of production of L-DOPA. And going back to psychopharmacology, L-DOPA is one of the rate-limiting chemicals in the production of both dopamine and norepinephrine. In other words, if we don't have enough of L-DOPA, those chemicals aren't made in the amounts that you would need. And vitamin D, most often people get it by supplementation, but it can also be found in fortified milks, cereals, fatty fish. And again, the Mediterranean style diet is consistently mentioned as beneficial for mental health. There are others, right? So it's not the only one, but it's the one with the biggest evidence and the one that has the most flexible diet, right? You get into things like ketogenic diet has some benefits for mental health, but it's very restrictive. And a lot of people aren't able to follow that as closely. So the Mediterranean style diet provides that flexibility people need. One of the things that can be really helpful when talking to patients about nutrition is talking to them about nutritional hygiene. And I actually have a handout that I use with my patients. So we talk about sleep hygiene because we recognize the importance of sleep for mental health. The thing is there's also a really important need for adequate nutrition and for the parasympathetic response that goes along with the whole process of eating, right? So when patients sit down to eat, we want them to start increasing parasympathetic function. And one of the ways that they can do that is to sit down, smell the food, like use all of the senses when you eat, because that improves parasympathetic innervation. Patients, everybody should strive to, when you're chewing, 20 times before they swallow, because smaller particles offer better digestion, and better digestion makes sure that nutrients are actually adequately absorbed and used by the body. Avoid over consuming fluids while eating. A lot of times people will drink a lot of fluid with their meal to help with swallowing, to lubricate swallowing. The problem is that fluid fills you up with things that are not as nutrient rich, and it encourages people to not chew enough. So the answer to lubrication for chewing is chewing more, right? Do keep in mind, though, dehydration is actually associated with decreased mood, problems with concentration, and increased perceived difficulty on tasks. So we want patients to stay adequately hydrated. They just shouldn't be taking their fluid so much while they're eating. Put the fork down between bites. For one thing, it allows people to be more mindful of what they're eating. And again, that parasympathetic innervation becomes the key. It also increases the time to finish your meal. We all know that there's a lag time between when your belly is full and your brain actually gets the signal that your belly is full. So putting the fork down and making sure that we chew enough makes us less likely to overeat, which reduces the risk of things like obesity and other things that contribute to problems. This also increases relaxation, right? Enjoy a meal with a friend or a loved one, since we have them in our house and it's just handy, right? Chewing longer is a consequence of having someone to chat with, right? You're slower chewing, longer pauses between bites. And the last thing is encourage patients to take a quick walk afterward. This improves glucose control and ensures that those nutrients are being absorbed because it increases blood flow everywhere. Okay. And then finally, some other tips to kind of keep in mind. First, how many of you have told patients when you're doing teaching about diet or nutrition, all things in moderation? The only problem is the more someone likes a food, the more flexible the definition of what's moderate becomes. So you want to be specific where possible. And so rather than saying all things in moderation, you can say things like, pay attention to your serving sizes. When you talk about alcohol, what exactly does it mean for them to be moderation? There's scientifically dictated resources for that. Rigid diets don't work. They do not work. They don't confer long-term benefits in terms of weight control, which is why many people will follow them. And in fact, the evidence suggests that rigid diets can lead to problems with eating disorder type symptoms, mood issues, and if there's anybody here who's been on a diet, I was on a diet for a lot of years. All I thought about was food. All the time, food 24/7. When you remove that rigidity, that rumination tends to recede. And something else to consider. Society tends to focus with things like nutrition and obesity and a number of other things on willpower. Willpower, unfortunately, oversimplifies the relationships that we have with food. Food is a social thing. Food is a communal thing. Food is reward in so many ways. Food is something that we use to celebrate, but it's also nutrition, right? And there are numerous factors that go into whether or not willpower is enough. And so that discussion really needs to be changed. To one where we think about the different ways that food is important in our lives and talk about ways to make it so that it's more about the needs of the body while also being able to enjoy the comfort and parasympathetic response that comes along with eating. Willpower itself can be improved by things like good sleep, social support, and there's great evidence that suggests that teaching patients to do small things builds evidence that they can do these things, the willpower thing. And over time, those small acts can actually become generalizable successes in other ways in their lives. So my references, hopefully I got my APA right. All right. You all have the floor. You can ask questions about the presentation. You can ask questions about things going on with clinicals or questions about the program, whatever you like. The rest of this 20 minutes is yours. And if you all have nothing, then we'll let you loose. So, but having something is not a bad thing. So there you go. How'd everybody feel about the presentation?
I really enjoyed it.
Hi, Sherelle, thank you. I'm glad.
Oh, yeah, it was nice. Thank you for sharing that with us.
Yeah, I really, the more I learn about this stuff, the more I realize that, I have a job prescribing medicines as part of the deal, right? And I like my groceries. However, if I can minimize the chemicals that I'm using by helping patients to eat more nutritionally, then that to me is a win-win across the board. Now, how many of you, as you're watching this, were wondering about things like food deserts and the fact that a large fry costs $1 and a salad costs significantly more? How do you help patients who are on a budget and they have kids or whatever? What can we do to help them? Well, one of the first things that I talk to about my patients who are on a budget, frozen food, frozen vegetables, frozen fruits are minimally processed. And so they retain many of the nutrients that are so important in them. The other thing is replacing that Wonder Bread, so awful for you, with whole grains. And sometimes, you get patients who are like, but the texture and all of this. And I talk to them about things like risk for dementia and how that one thing can make a difference longer term. And how, yes, it's a little more spendy, But when their kids eat the PB&J on whole grains, they're going to be fuller for longer, right? And so they're spending less money on that. And then the other thing that I talk to them about, and a lot of times people look at me like I've grown a third eyeball, is becoming advocates for themselves and their communities. I live in an area in Denver that up until white people moved in was a food desert. And that's unfortunate. That happens in a lot of cities and a lot of communities across the country. So how do we help people to understand that their voice is important, and that maybe if they get together in their communities and raise a stink, they might be able to get something done? And then voting can make a difference, right? Because there are people who have good ideas about how to fix these issues, and you want to make sure that those are the people that are coming into office. So that's my only politics rant today. How about y'all? Anything else? What do you guys think? Amanda, Matt?
I have a question. Just throw this out there. I saw a patient today in therapy. And in my observation and listening to what was going on, and he is diagnosed bipolar, maybe schizophrenic. He's 26 years old, and he just tells therapists he doesn't want to eat. There's no foods that he likes, no textures he likes. He eats to survive, and he's 26 years old and probably 120, 125, and he's 6 foot tall. How are we supposed to guide these individuals to a better nutritious intake?
That fella sounds like hopefully his therapist is addressing things like AFRID, right?
Right. I mean, he's trying.
Sure.
I'm just learning about this patient, but he's it's from the therapist has seen him for 3 years now.
Yeah.
And he not only is it him, but he also has 2 brothers that live in the household that are the same way.
Yeah.
They are gamers. They don't want to come out of their rooms. They don't want to, it's and they talk in circles, and it's just wow. How are you guys surviving? His one brother is now the only thing he's a liquid protein shake kind of guy. And so I can see it, and my therapist will see all 3 of them. We'll see all 3 of them this week. So it's going to be interesting to see how that comes about, and that's to see the difference in the 3.
Yeah, that's hard. And you get the same kind of thing with kids who have texture issues or what have you. And kids especially are so vulnerable to all of the different chemicals and sweets and all of that, is if they're introduced at a young age. I can't easily answer that. It really, a lot of times these are people I'm going to send to a dietary consult, to nutrition, and see.
Well, his comment was just plug a tube in me, and that way I don't have to taste it or anything.
Yeah, that's a tough one. And Sherelle, Natalie, any thoughts from you?
Well, I appreciate your talk tonight. I work on a psychiatric inpatient unit, and it is incredible the amount of food that they offer to these patients and the snack choices. And we know, throughout my years of education, talks like this, I've heard them before. So it's surprising to me that these hospitals, they're charging. I've seen a bill for a 1-month stay on an acute inpatient unit, and it's close to $200,000. And we have numerous patients that are waiting for state hospital placement, and they're there for a year.
Yeah.
And they are eating literally 3 bags of chips, pretzels, fig Newton bars, peanut butter crackers. They think prune juice is their you know, area for constipation, like that's what they'll consume. Shasta sodas, these, you know, cupboard juices, and that's what we're giving them. So I'm watching people who are on antipsychotics gaining a massive amount of weight. There's no exercise. They lay in their bed and we wonder why they are so depressed, so constipated, so agitated. And the food, it's wild what you see in the, I'm like, the amount of money that they charge and they can't provide.
So I lied. I have another political rant. How many of you think that that has anything whatever to do with evidence-based hospital practices? Nothing. How many of you, like me, think that's about what's the cheapest way, because our system is based on profit over people, period, end of story.
Sure.
So
I'd like to say two things about that, Amanda. I'm definitely with you, because after working 10 years in a forensic state hospital, I'm getting feedback and don't know why. In a state psych hospital, I've witnessed the same thing, right? So we're giving them commissary, which allows them to go and get ramen noodles. What is ramen noodles? Just sodium, right? So, you know, they're just blowing up. You watch it, and it's sad when you definitely care about the people over the profit. And in regards to Matt's case, I was really thinking, Dr. Lori, this is really the email that you just sent on interdisciplinary and the importance of, you know, therapy, working with the med management when it comes to psychomed management, nutrition services, probably even vocational services, if that it could be offered in that community, because it's important for a 26-year-old not to sit down all day just being a gamers, right? So it's important to become, you know, a citizen, do things to help develop. There's very little development going on with just gaming all day. A lot of times they don't want to take time out to eat because they're in the middle of a game, or, you know. So definitely, I think interdisciplinary services are needed for that case for you, Matt.
excellent. Yeah.
I was thinking that as well. I mean, the hardest thing was just to listen to him. He talked about his conflicts with his parents, because he says his parents work to take care of him and his brothers and his brothers, and he doesn't see what the reasoning why. And it's like, wow, you know, he has no goals in life, you know, and you know, the therapist says, you know, so let's set a goal for what you to do this week. You know, we live on the beach. We live in one of the, you know, I live in Daytona Beach, Florida. It's not the most beautiful beach in the world, but it's a wonderful place. How about you just go to the beach and walk on the beach a couple of days this week? Because he's not interacting with anyone except his gamers. And he's like, well, someone will say something to me. Well, you don't have to really interact with them, but just see if they make eye contact with someone. Just make that as a goal, because they want to get him away from the whole family, including the father and the mother, do come to the therapist with the same therapist. But for 3 years, this has just been, and I'm sure it was going on a lot longer than 3 years, but today was the first experience with this. And it's like, wow, you know, I have a child that's on the autistic spectrum. So I understand his textures. I understand that my son makes goals. He doesn't always achieve his goals, but he's out there making a goal. Where my son is almost 30 years old. He still lives at home, and his mother and I understand, but it's part of the spectrum. But he sets goals. He is active in the community. He does participate in his education. He does go out and volunteer. He does work. He's an active member of the police department. So he's out there. He has interaction and stuff where this person I'm seeing that's basically 3 years younger than my son, who doesn't want anything to do with the world at all, except the world of his game. And what's really crazy, his game is wordscape. So where's, I really, is that challenging? I mean, and then when he says, I was just totally shocked when he said, just plug a tube in me and feed me through a tube. That was all he cared. He's afraid of dying. He doesn't want to starve to death. He'll eat to keep from starving, but he doesn't want to, he doesn't, the rest of it, he just doesn't care. And it's like, it's really sad. And as far as, the psychopharmacotherapy, he will not take medications. So there's another problem,
Because he's depressed. It sounds like.
extremely to me was, yeah. And it's really just one of those like, wow, and his father, so his father called in, but prior to tell about the week, and that's so that we can kind of, at least from my therapist that I'm working with, so he has somewhere that he can at least start out with, because this kid just, and I call him a kid because he's 26 years old. And to me, I'm 61. I'm sorry, I'm not a kid anymore. But there just doesn't seem to be. There's no focus.
Right.
And he doesn't want to focus, what it appears to be.
That's
and,
a case. Wow.
Yeah, and so the father says, hey, he ate twice this week. We saw him once during the week prior to me dropping him here and he does not drive. So he goes out and gets in the car and he drives him to the therapy, and he sits there for an hour and talks with Ed while I was observing today. And it was like, really? And you really couldn't bring him back into focus on anything. And he changed his story probably 6 or 7 times in an hour's time about different things. But he never would go back to the same thing.
Right.
So, I can see where he's talking about the borderline schizophrenia also, but he says he does have drastic mania and then depression. Right now he appears in the depression stage. I'd be interesting if it works out through the next few weeks, if he goes into a manic stage.
Right. Wow.
But I keep everybody up to date.
Please. Very interesting. Anybody else have any thoughts? Well, okay. So in your clinical courses, there is a reflection about this presentation that you'll be doing. And so if you have any questions, feel free to shoot a message or ask Sherelle or Natalie or, any of your clinical faculty. And, there's a lot of increasingly a lot of good resources for this. One of the places I found some great information is the Harvard T.J. Chan School of Public Health. They have a website dedicated just to nutritional resources. And you can look at individual nutrients. You can look at the broader picture. It's really full of a lot of good information. And increasingly, there are resources dedicated to nutritional, integrative, and functional psychiatry. There's a lot of overlap. So I'm not sure where the names, but there's a lot of really good evidence-based resources, and it's growing. It's a field that's definitely growing, and I think that's for good reason. Okay. All right. If there's no other questions, thank you all for coming tonight. I appreciate your time, and let me know.
I have one more little
go
thing.
ahead. Yes.
So on the APA certifications that we were in 732
Mhm.
with the, so I went ahead and did the APA, that certification with the CE, because I realized that, well, I'm a member of APA.
Mhm.
So I just, so do I still need to do the quiz along
Oh,
with
if
it?
you've got a
or-
certificate, throw it in there. It's fine.
Okay,
Or
I
is it
just
not
wanted
gonna
to,
make everybody pay for it since they changed
yeah,
the rules on it?
right. I mean, my wife reminded me, hey, you are a member of APA,
And
you
it's
as
a
a
good
student.
resource. I really enjoyed,
So-
it's a really good, but I'm not, a lot of people on a budget and I can't
Mhm.
force people to pay for something. The rest of them I did go back and double check are still free. So you just need to have an APA login. You don't have to become a member to have a login. And a lot of the diversity ones, and there's a few others, are free and they're well done. So I figure, why reinvent the wheel if there's something that's already there that's good, right? And if you have any trouble with any of it, just let me know.
Okay, thanks.
No troubles. That's what they pay me almost the big bucks for. All right, ladies and gentlemen, have a great rest of your evening. I will see you all soon.
Thank you.
Of course.